Hi guys, today we're talking about neck pain. If you're suffering from neck pain, please don't feel embarrassed or alone. Did you know that 67% of Australians are suffering from neck pain of one form or another? Today we're going to talk about neck pain, what it is, what can cause it, and how various things might be able to provide some assistance for you to finally get on top of this limiting condition. We want you to be the best person you can possibly be and not be stuck at home worrying about a sore neck or letting it affect your moods with your family members or your kids, because that's ultimately what it ends up doing. It's a real healthcare concern. When we look at the spine, we're going to be looking at the neck today because that is the area of concern. The cervical spine contains 7 cervical vertebrae, and a vertebra is one of these bony segments. Now each vertebra, one sits on top of the other and so on, coming all the way up to the neck. Now these vertebrae surround what we call nerves, and it's these nerves that come off the spinal cord that they take information to and from the brain, and when working properly they have no reason to be inflamed, in pain, or providing any sort of resistance towards your daily activities. They simply transmit and communicate effective information. Now sometimes when we get joint related disorders developing, or we get, which is degenerative disorders in around here, or you might like to think of it as arthritis of the spine, or when we simply get segments sitting in the wrong location, it's putting a lot of increased pressure on these poor little nerves through here. Now just the slightest bit of pressure, we're talking very, very, very minute amounts, can drastically change the effect and response rate of these nerves travelling to the brain. And that activates what we call pain pathways. Now the prolonged activation of these pain pathways develops into a chronic condition whereby you're constantly in neck pain. You're limited by what you can and can't do. The common methods for treating this kind of condition, they vary. Anti-inflammatory drugs seem to be a popular choice. Fortunately though, people are starting to realise that this doesn't provide any long-term solution. They can be very effective in a very acute trauma situation in which the joint becomes very inflamed. They can help bring down that inflammation and take off some of the pressure on these nerves through here. However, that's a very short-term effect. If these conditions are ongoing, so to speak, then it becomes a more chronic concern, and anti-inflammatory drugs have been proven to have no beneficial effect. Here in chiropractic, we like to get to the bottom and look at exactly how much disruption there is to the joint, how much pressure there is being placed on the nerve, and take manual approaches towards alleviating that pressure on a more permanent basis. And this is what forms the means of a chiropractic adjustment. The common causes for neck pain developing in the first place tends to be, often it is posturally related. We aren't actually designed to sit for long periods, yet most of us spend 3/4 or more of our day seated, driving, sleeping and the likes. And this is when we tend to, it results in our head moving in front of our shoulders like this. Now can you imagine walking along like this all the time? Have you ever seen that old person down the street who can't turn their head very far? Well, that's becoming very common even among children in today's society. And that's causing drastic health concerns up through here. And pain is just but one symptom of these healthcare concerns that you should be concerned about. So that is one big factor. Secondly, it could be the position you sleep in. When you're sleeping on your side, is your head sort of jammed up into your shoulder like this, or you're being pushed away? You want to keep your shoulder and your neck in a neutral position. If it's not in a neutral position, you need to get a pillow that's appropriately suited towards your neck. Everybody that I've ever seen here at my office has a different shaped neck. So don't be fooled into believing that one pillow fits all. That is not the case. Lastly, there are some more complex patterns which can develop. We're not going to go into those today. If you feel as though you're ready to make the next step or would like some further, more specific information, then I strongly encourage you to book an appointment today at my office. You can do that by contacting my friendly staff on 0889421920, and they'd only be too happy to help. Secondly, I've put together a very in-depth report which you can find a link to below. And please act on that one now, and I'll have my staff mail it out to you today. Have a fantastic day, and I hope that this has assisted you in improving your overall well-being in the long term, and encourage you to act upon this debilitating condition before it gets beyond you. Have a great day. See ya.